Hello students, welcome to All About Nursing channel. So today's video is going to about the nursing care plan on asthma. So first diagnosis of first nursing care plan we can write a patient who are suffering from asthma like ineffective airway clearance related to bronchoconstriction or bronchospasm and increased mucus production as evidenced by presence of productive cough or sputum or presence of any adventitious lung sound. There can be wheezes, there can be rhonchi. So we can write like this, or increased respiratory rate, or there is increased respiratory effort, there is use of accessory muscles. So those are the evidence that we can give by through the observation we got on the assessment. So like this we can write the diagnosis, that is ineffective airway clearance related to bronchoconstriction secondary to asthma as evidenced by presence of productive cough, increased respiratory rate, mucus production. So those can be written. So first the foremost diagnosis will be the ineffective airway clearance. So there will be a goal that patient will demonstrate effective airway clearance. So there is improved respiratory conditions of the patient. So here we can do that patient lung sound should be auscultated respiratory rate, or the respiratory function should be assessed by examining the pulmonary functions, like by using stethoscope. We can check the lung sounds, is there is any adventitious lung sounds is present or not, is the respiratory rate, pattern, depth should be assessed, and after that we have to check for any productive cough is present or not. Okay, next we have to give the patient, that we all know that for ineffective airway clearance we have to give a comfortable position, like for effective airway clearance we have to give the patient a high Fowler's position for effective oxygenation. So we all know that common position, and we have to provide a well ventilated room. That is all about our part, and we have to give the medication according to the doctor's prescribed medication, that is bronchodilators we can give through nebulization, and we have to give supportive oxygenation if patient is needed. So we have to give oxygen, it can be through nasal cannula, through mask, so through this, and we have to increase or encourage fluid intake of the patient, so that helps in liquefaction of the mucus, and that easily remove the secretion. If we maintain the hydration of the patient, so that easily liquefy the sticky mucus, and that easily remove the, by which easily removal of the mucus or sputum can be happen. So that can be the nursing diagnosis, that is foremost diagnosis. Other than that, related to the diagnosis, that is ineffective airway clearance, we can write ineffective breathing pattern or impaired breathing pattern. Okay, then ineffective tissue perfusion we can do, because of due to lack of oxygenation we can write the diagnosis, that is ineffective tissue perfusion related to lack of oxygenation, or bronchoconstriction, lack of movement of oxygen. So that we can write. Okay, so related to this, because all these diagnoses, the interventions are quite same. The ineffective airway clearance or impaired breathing pattern or tissue perfusion. So they are near about foremost, the interventions are near about same. Next diagnosis can be risk for activity intolerance, because a patient due to decreased oxygenation the tissue are not functioning properly. So there can be the risk for activity intolerance or activity intolerance. That can be potential or that can be actual diagnosis. In some patient, asthma patient, there is activity intolerance itself present, or the patient who are chronic suffer from asthma. So there can be, if there is no acute phase, so there can be risk chances or potential diagnosis can be there. So we have to help the patient in their daily living activity. We have to encourage patient for range of motion exercise or passive exercise. We have to give the patient, instruct the patient for deep breathing exercise. Okay, so those are the diagnoses. Next we can write that insomnia due to the asthmatic attack, there is foremost chance of insomnia, so that can be there. Other than that, fatigue is there, imbalanced nutrition, less than body requirement, that can be a diagnosis.